So make sure you keep your video blocked unless you care, you don't care if you're recorded. But also, just a couple of notes, keep your mic muted as well as we go through this. And we will have a live Q&A at the end. So if you have questions you want to throw into the chat, throughout the presentation, do that in the chat, but please keep your audio muted until we get to the live Q&A. Okay. So back to our agenda. Just so you're all aware, my name is Ben. I'm a financial coach with Fair Credit Foundation. And today what we're going to be talking about is managing medical expenses during COVID-19. So our first speaker is Riley Curtis, and she's going to be talking to us about medical health's role in financial well-being, and she'll be introducing herself. After her, we're going to have Natalie Stubbs from AUC, which, give me just a moment to remind myself. So that's the Association for Utah Community Health. She'll be speaking to us about their services and providing an overview of what they provide. And then Mackenzie Walsh, she's one of our financial coaches here at Fair Credit. She'll be talking about medical expenses and your finances. And then to wrap up, we will have Heather Marshall again from Fair Credit Foundation. She'll be conducting talking about our outreach and conducting our question-and-answer section of tonight's webinar. Again, thank you all for being here, and let's turn the time over to Riley.
Hi, everybody. Thank you so much. Can you hear me okay?
Sounds good to me.
Okay, thank you. So my name is Riley Curtis. I'm the Director of Community Engagement for University of Utah Health. And I have a background of working with nonprofits in the state of Utah, working on Medicaid expansion to expand the Medicaid program to over 100,000 Utahns that previously were not eligible for Medicaid because they did not meet categorical requirements. So I'm going to talk through with you all today about just different medical programs that you may be eligible for. And OUCH certainly helps enroll people in these programs as well. And there may be a little bit of overlap, but hopefully not too much. So next slide, please. So many of you may have seen this slide before, and it may be news to some of you, but it's really interesting. Over the last few years, there's been this movement in healthcare to start to address what's called the social determinants of health. So really about 20% of a person's overall health can take place and happen within the four walls of a hospital system. And the rest are made up of health behaviors like whether or not somebody has a sedentary lifestyle, drinks or smokes, physical activity, where you grow up, are you in a heavily polluted area, and then socioeconomic factors like are you going to fabulous institutions like SLIC and getting an education? Do you have family support? Do you have a job? And those all, the remaining 80% have a significant impact on an individual's overall health. It's not just health that can be provided in a doctor's office. So it's really important to make sure that you go through the education process, that you do the things outside of the healthcare institution that can help you address your overall health. So next slide, please. So this is importance of preventive services. So a lot of people think, well, I'm not sick, I don't need to go to the doctor, but a lot of what we can do within the healthcare institution, so that 20%, is help people with preventive services and screenings. So 7 out of 10 US deaths are caused by chronic disease, while roughly half of the country's population has been diagnosed with a chronic illness. So a lot of this has to do with not getting screened for preventive services and waiting until it's too late to go to the doctor's office and to get tested for these services. And then it's far more expensive to treat any one of these different chronic conditions when it's diagnosed and it's not in the preventive stage. So think of things like heart disease, any type of cancer, diabetes, and HIV and AIDS. Primary care providers can certainly help with any type of immunizations, and then they can also do these preventive services. So just when we're talking about how healthcare relates to financial health and well-being, just remember that it's super important to go and get your preventive checkups to make sure that you're not in those late stages of any one of these chronic conditions. And in order to get preventive services, health insurance and access to healthcare is super important in that equation. So let's go to the next slide. Actually, I have one more before we talk about health insurance. So you can go, go to the next slide, the bankruptcy slide. So you can go to any healthcare provider. You could go to federally qualified health centers. You could go to a health system like University of Utah Health, and you can pay out of pocket. We're likely going to offer you a cash discount, but I will tell you that once you get diagnosed with a chronic condition, it's going to be extremely expensive to pay for that health condition out of pocket without health insurance. So the number one cause of bankruptcy in the United States is medical bills. And it's extremely detrimental to individuals' financial well-being. So you can have something like a high deductible health plan, which has very low monthly premiums, but a very high deductible before insurance kicks in, meaning you could pay, just throwing a number out, like $25 a month. But then if you do have a health issue, it could be $5,000 to $10,000, depending on your plan, before that you are responsible for out of pocket before. And so there are plenty of options outside of high deductible health plans that we'll talk through next that can definitely help you maintain a balance between out of pocket costs, making sure you're insured, and your financial health and well-being. A lot of bankruptcy happens because individuals are uninsured or they do have that unexpected injury or illness. And then oftentimes folks will skip medications to cope with medical debt. And that again just creates bigger costs in the long run for individuals because they're not taking care on the front side, their health issues, and then they get diagnosed with these chronic conditions. So bankruptcy can stay on your record for up to 10 years. It damages your credit. It's difficult to file for any kind of loan. And then again, the record doesn't clarify that it was because maybe you got, a cancer diagnosis and were uninsured. It just shows that you filed bankruptcy. So making sure you stay on top of your health is very important. Okay, next slide. So the importance of insurance coverage, again, it gives you that peace of mind for injury or illness. It covers preventive services to stay healthy or detect those problems when they're treatable. And insurance plans can also negotiate discounted rates with providers to help lower the costs on the back end for the individual. So next slide. So I'm going to talk about government programs. So Medicaid is one. As mentioned, I helped previously, before I was with the university, I ran the campaign to expand Medicaid to over 100,000 Utahns. Before, if you have ever applied for Medicaid and were denied, I suggest that you try applying again. Previously, you had to be fit into a category like being a child, being a pregnant woman, being age blind or disabled, but now it's open to all Utahns, all Utah residents who have a legal status, and they do have to meet the income requirement, but they no longer have to meet that categorical requirement. So if you're looking at this chart here, if you are a family of two, like my husband and I, we have no children. If our monthly income was below that $2,000 a month, that 1983, then we would qualify for Medicaid. So that's how you read that chart. Medicaid members, they don't have a premium, so there's no monthly out-of-pocket cost to be enrolled in Medicaid, and they do have very minimal co-pays. So it's about $4 per prescription, $4 for physician visits, $4 for vision visits, and inpatient care at $75. So this is an extremely robust Medicaid package that offers benefits like prescriptions, doctor's visits, family planning services, so birth control if you're wanting that, maternity care, preventive and wellness services, all of those things. So next slide, please. Oh, and you can apply for Medicaid year-round. So that's different from marketplace coverage. So marketplace coverage, this is also known as like Obamacare or the ACA, Affordable Care Act, Marketplace, they're all kind of synonymous. So this one is for people who don't qualify for Medicaid. So if your income is between 138 and 400%, so that red bar, then you're going to qualify for marketplace coverage. Now, the closer your income is to that 138% of the poverty level, the more federal subsidy you're going to get to help you pay for health insurance. So again, I'll state this another way. If you think about employer-sponsored insurance, you get a job, you're responsible for a portion of your premium, and then your employer pays for the other portion. So let's do 80-20. You get a job, you pay 20% of your employer premium, your employer pays that 80%. Think of the federal government as being that employer part. So the closer you are to that 138% poverty, you're going to pay like either 0 to 10% of your monthly premium, and the federal government will subsidize the rest. And then as your income goes up to that 400% of the poverty level, you will likely pay 80 to 90% of that cost, and the government will pay that 10%. So as your income goes up, your subsidy goes down. So the difference between marketplace coverage and Medicaid is that it is through private health insurance plans. It's not through a government program, and it is closed and it's got an open enrollment period. So between November to December every year, there's an open enrollment. Anybody can go in and they can put in their income, see what they qualify for subsidies, and then they can enroll. And if you have a special life event outside of mid-November to mid-December, then you can qualify. So if you graduate from college, if you get married, if you turn 26, all of those things listed there, that will open the key for you outside of that open enrollment period. But again, if you don't have any of those life events and you're trying to apply, say, even this month, then you're not going to be eligible to enroll in marketplace coverage until it opens up again in November, or you have one of those special enrollment periods. Next slide, please. So this is my last slide. If anybody has questions about how to apply for Medicaid, CHIP, Marketplace, these are two really great resources for you. If I'm not mistaken, I believe OUCH, the Association for Utah Community Health, is still part of Take Care Utah. But you can certainly go to Department of Workforce Services. They can help you apply for Medicaid with their caseworkers, or you can also just visit that website and try to do the application on your own. You can also call the number and ask any questions you may encounter as you're doing the application. And then Take Care Utah, this is a nonprofit organization that was established after the Affordable Care Act passed. And this is specific to Utah. They're a nonprofit, or they're going to help you enroll in Medicaid, Marketplace, and CHIP. Department of Workforce Services can't help you with that Marketplace application. So if you're not sure, if you're going to qualify for Medicaid or Marketplace, I would suggest going to Take Care Utah, and they will help you navigate that. They'll also help you pick a health plan that is right for you. And their services are free, they're statewide, and they're often available in multiple languages. So they're a really good resource. And I am happy to take any questions you guys might have at the end. And thank you for having me.
Thank you, Riley. We really appreciate it. And both all of your work you've done in the community, as well as with the information you've provided this evening. Next, we've got Natalie Stubbs. So Natalie is a graduate of University of Utah. She got her bachelor's in social work in 2016. She went from there to work with Somali refugees and joined the WYCA Utah. Afterwards, she then was offered a position at the Association for Utah Community Health, or the OUCH, where she currently works, and was a data resource coordinator. Since she has now moved on to the position of Training and Technical Assistance Program Manager, overseeing the training and technical assistance offered to health center grantees in Utah. So thank you, Natalie, and I will now turn the time over to you to talk to us about the Association for Utah Community Health information.
Great, thanks so much. You can go ahead and jump to the next slide. So just kind of my goal for today is hopefully when I'm done, you have a better understanding of what is OUCH and what we do, what a health center is, how do health centers improve the health of Utahns and the impact and what it takes for a health center to be in existence. Next slide, please. So the Association for Utah Community Health is the federally recognized primary care association in the state. So really our role is to support health center grantees with any training and technical assistance they may need. Every state has a primary care association. We are federally funded and we operate very similar to a trade association if that's a helpful comparison. Currently we have 20 member organizations and each year we offer roughly 12,000 hours of training and technical assistance to those organizations. Next slide, please. So just so you have an idea, while we have 20 member organizations that are a part of our association, 13 of those are health center organizations. That number has changed. It's no longer 52, it's 54 clinic locations. But as you can see, they span across the state of Utah and provide access in very rural communities as well as very urban communities. And really their purpose is to eliminate geographical and financial barriers and serve populations that have limited access to healthcare. Next slide, please. So kind of what we do on the back end is we try to help reduce those barriers to healthcare through health promotion, community engagement and development, education, and policy. So kind of as Riley mentioned, we worked closely to help expand Medicaid to help our health centers hopefully receive more Medicaid patients and therefore offer more care to more individuals throughout the state. We do a lot of community engagement and partner with stakeholders on behalf of health centers to try and get them access to different grant funding and opportunities that they don't necessarily have at the time to dive into on their own. Next slide, please. So as I said, our role is really to provide training and technical assistance to these health centers. So that's anywhere from clinical to financial to, grant requirements, governance, things like that. And by doing so, we help those health centers expand access to care to more individuals. One thing to note is that we are not the owner or operator of any of these health centers. I think there's a lot of confusion in the community at times that, they're referred to as ouches clinics, but they really are, our board is made up of the CEOs from each health center organization. And so all of our work is really driven by the needs of the health center and, what they'd like to see from us. Next slide, please. So part of things that we offer at Ouch, we have an AmeriCorps team, and they really focus on being placed at those health centers and really focus on social determinants of health with patients. So oftentimes they'll do things like if a patient has asthma, they'll connect them with the local nonprofit to get their air ducts cleaned for free. They'll provide resources to groceries and food vouchers and things like that. So they're really the boots on the ground that are really on site with the health centers. Next slide, please. We also have a community health worker program, and these individuals come from the communities that they serve. And so we have teams located across the state that focus on overcoming social and medical barriers that are impacting the patients at the health centers. And really, the project is funded through Intermountain Healthcare and with some other funding sources, but really their goal is to go on site and help patients in their home and really get a good look at what their needs and barriers to healthcare are. So for example, if a patient has diabetes but they don't have a fridge, how are they supposed to control their diabetes? Next slide, please. So just to kind of give you an overview of what community health centers do, and how they operate and how they're different from, you know, let's say like a university clinic or an Intermountain clinic. They're funded through the Health Center program, which is a part of the Department of Health and Human Services. So they have a branch for the Bureau of Primary Healthcare that really supports these organizations so that they can serve these medical underserved areas and populations. The health centers are community-based and patient-directed. And so what that means is 51% of the health center's board is made up of the patients that they serve. And so they're really unique in that. So the patients really drive what they want to see from the health center. Next slide, please. So this graphic is just to kind of give you an idea of the different kinds of health centers. The most common one in Utah is just a community health center, but there are other types of health centers. There's healthcare for the homeless, and the only homeless health center grantee in the state of Utah is 4th Street Clinic. There are a few migrant health centers that are in rural locations, but Utah does not have any public housing health centers because we just don't have enough public housing to make it sustainable. Next slide, please. So just to kind of give you a history of how community health centers came to be, in the 1960s, President Johnson declared a war on poverty, and the community health centers were proposed by the Office of Economic Opportunity to really target the roots of poverty by combining the resources of local communities with federal funds. And the goal, again, was really to help those medically underserved populations. And interestingly enough, some of the first physicians that helped found these health centers would prescribe food for those who had food insecurities. And so just kind of an interesting tidbit. You can jump to the next slide, please. So the first health centers were located in Massachusetts and Mound Bayou, Mississippi. It was really kind of started as a demonstration project to see if these would really work. And when, you know, the government saw the benefit of these health centers, it just exploded from there and just became a nationwide really effort to make sure that community health centers were located in areas where in really medically underserved areas. Next slide, please. So this is just kind of give you an idea. This map is a little older, but these are the health centers that are located across the country. So you can see they're all over the place. I personally didn't know about health centers until I started at Ouch. And I was a little bit shocked that, and I guess disappointed that I didn't know about it sooner, just given the quality work that they do and the services that they offer. You might also hear them called federally qualified health centers or FQHCs. It's all the same thing. So if you hear the two different terminology, just know that it is still a community health center. Next slide, please. So nationally, just to give you an idea, you know, and this number has gone up as well because this is from 2015, but each year 25 million patients are served through these programs. That's 1 in 13 people in the United States. And so you can kind of go through and look at these numbers and just see, you know, if we didn't have health centers, how many people would go without care? I mean, the numbers are just astonishing. So, you know, I'll just kind of bring it back to a local level if you want to jump to the next slide. So in addition to meeting their federally mandated requirements, health centers have really gone above and beyond to ensure that they're, you know, meeting the top level of excellence that they possibly can. There's a few accreditation, if you can see on the right, those graphics, there's some accreditation that they can achieve that they don't necessarily have to achieve, but it helps ensure their quality measures and their clinical outcomes are staying above or on par with other health systems in the country. Next slide, please. So to give you an idea, in 2015 in Utah, the health centers had 457,000 visits. 77% of those were medical, 12% were medical or dental, and then you can kind of follow that graphic below. Those have also changed given the opioid crisis and things that have really ramped up in those areas. But really the idea of a health center is it's a one-stop shop for all of your needs. So it's a really comprehensive model. Most health centers in Utah either have these services on site or they contract with someone to make sure that patients have access to these services. Next slide, please. So again, in 2015, there was 142,000 patients in Utah that were seen. 71%, excuse me, let me back up. So 72% of those were 100% poverty level or below. So these really are people that would go with healthcare otherwise. And if you look at the patients by payer, 55% on average in the state are uninsured. That varies from health center to health center, but essentially they receive this grant funding so that they can see uninsured patients and so that these people don't go without care. It's a pretty small percentage of Medicaid patients, which is part of the reason that we were advocating for Medicaid expansion so heavily, because that's a source of income that would help boost the operations of a health center that is otherwise being covered to help those uninsured patients still receive care. Next slide, please. So looking at healthcare for the homeless in Utah, as I said, we have one healthcare for the homeless grantee, which is 4th Street Clinic. But in fall of 2015, we had 2 organizations who opened homeless health center sites. So in Ogden, the Midtown Community Health Center opened the Hope Health Center, which is in the Lantern House. So it's a really integrated model. They're right there in the shelter, easy access to care. The other site was in Mountain Lands, which is in Provo, and so they worked with the Food and Care Coalition to open the East Bay Health Center. And I don't think a lot of people know, but you know, the I-15 corridor really is the corridor for homelessness, and so making sure we're hitting along that corridor is really important. Next slide, please. So again, you know, the numbers are pretty astonishing as to how many patients these health centers see, but I really want to emphasize health centers oftentimes are the only source of care in rural communities. So Green River Medical Center, for example, is located in Green River. If there was not a health center in that community, patients would have to either travel to Price, Grand Junction, or Moab to receive care, all of which are over an hour away. And for someone who has a transportation barrier or a disability that doesn't allow them to travel, they really would be in dire straits. You know, there's still underserved populations in urban areas, obviously, but there's a little bit more access in those urban areas to other sources of care. There's always pressure for these health centers to improve and expand services, and you know, that can be compliance with multiple agencies, rules and regulations. There's always pressure for social determinants of health, the opioid epidemic. You know, that's been a new pressure that's, you know, been ongoing, but just barely came to the limelight federally to kind of highlight that as an area for need. One thing that I think is really interesting is these health centers get really innovative in the way they offer care. So for example, in Carbon County, the health center that operates there, one of their physicians actually goes to the jail anytime someone is booked for a DUI, for example, and he starts treatment in jail. And so they're able to be a little bit more creative because they are so embedded in their community and they work with agencies in a way that's not necessarily a larger health system would be able to do. Next slide, please. So, you know, as we increase these access to services and we modernize primary care and the delivery system of this primary care, it not only increases the value of the health center program, but it also improves health outcomes for patients. The nice thing about the health center program is that it's been supported by both parties. There's never been an issue across party lines whether this program is valuable or whether it should be funded. Sometimes it's just a matter of finding the funding. So that's something that I always appreciate about the health center program. Next slide, please. So again, for a health center to operate, they really have to be community-based. They have to serve areas of high need. They have to serve everyone regardless of their ability to pay. So, you know, they typically try and get the folks who are uninsured, low income, or underinsured. But the nice thing is, even if you have insurance and you have a high copay, for example, like if you have a $75 copay, and that's really going to be the difference between you getting groceries or not, the health center will work on a sliding fee so that it's adjusted on your ability to pay, which is a really unique delivery system. It gives patients a voice on how care is delivered. So again, they have that 51% representation of patients on their board. And they provide comprehensive primary and preventative care. One of the clinics, Utah Navajo Health Systems, they just opened a new clinic that has chiropractic care, physical therapy, it has a pharmacy, it has vision, it has literally everything you could possibly need as a patient, and it really transformed the community. Again, they do have a lot of accountability and performance. They have to meet 19 core program requirements from clinical to financial. And so one thing that Ouch really works with them closely on is making sure that they are able to move the needle on those quality measures and that they are staying in compliance. Because for a small health center that doesn't have a large staff, I mean, you could imagine the red tape and the amount of administrative burden that could put on a health center. So that's another part that we really play with health centers. Next slide, please. So in order to be eligible to become a health center, they have to provide all of these services. So they have to provide comprehensive care regardless of ability to pay. They really have to be community-based. And so, you know, if they're not able to do that, like let's say someone wanted to start a health center, if these boxes weren't checked, they wouldn't be eligible to, which is really nice because that's what we need them to be, right? Next slide, please. Some of the key services that they offer that I didn't touch on. So they do have to offer all of these services, whether they do it on site or whether they contract with somebody else, for example, like IHC. But one thing that's really nice is they have a pharmacy program where they have to work with some entity to ensure that there's discounted prescription programs incorporated within their system. So making sure that patients aren't having to pay $100 for a prescription. Any lab work or radiology services, oftentimes they have vouchers with local hospital systems to ensure that patients can get that work done. Lab work is so expensive, so they really help reduce that financial burden. And they also have to offer after-hours care. Next slide, please. Some of the benefits that the health centers have that other health systems don't have, again, is that drug pricing program to help reduce the burden on patients. They're eligible for vaccines for children, so patients who are uninsured and their children still need to be immunized, they're available for that program. Eligibility workers. So I just want to touch on this for just a brief moment. So Ouch works really closely with the health centers to do outreach and enrollment, specifically now that we have a portion of Medicaid expansion. And we do offer a health insurance premium support program. And what that means is that essentially Ouch has funding to cover a patient's premium once they've enrolled in the marketplace. And if that premium is not feasible, then Ouch would use that funding to help cover that patient's premium. That's all done at the health center. We're just kind of the back end managers of that program. So if that's something that is of concern, please feel free to reach out to a health center and ask about it. And then they also have access to other funding opportunities. So for example, with COVID and telehealth, there's been a lot of huge transitions for the health centers, and thankfully they've been able to receive additional funding to move to a telehealth platform and still offer the same quality care that they have been offering to these patients. Next slide, please. So, I mean, I would say that the demonstration project is a huge success. I think given the amount of care that is being provided to patients that would go without care is really phenomenal. There's still some challenges in place, you know, like any health system. The high rate of uninsured patients makes it, you know, they make health centers fiscally vulnerable, and oftentimes they have to seek other sources of grant funding to really recoup some of the costs by doing this. Recruiting primary care providers to work in remote and rural communities it can be difficult, especially if, you know, someone wants to live really close to somewhere like Salt Lake. But the nice thing is, if a physician or anybody in the healthcare field decides that they want to move into a health center, there are a lot of loan repayment programs and forgiveness for providers. And then, you know, the health center program is really personal to me for a lot of reasons, but specifically, you know, my brother got really sick and he didn't have insurance, and he went to a community health center, and they treated him like you know, they spent time with him, they really talked to him, and then got him a voucher to go to a hospital. And when he got there, they said that if he hadn't gone there within a week, he would have been gone. And so, I mean, I just like to think about it like, to a lot of health systems, you're just a patient that's like 15 minutes in and out, but these health centers really care and they really want to make a difference. And so I'm just really passionate about the program. And you can hit the next slide. So does anybody have any questions for me?
Natalie, we did have one come through. This is Heather from Fair Credit.
Okay.
They asked, do free clinics fall under the health center category?
They do not. Specifically, I believe the most well-known one is Malihé. They do not receive federal funding to operate, so they're not held to the same sort of quality and compliance metrics that a health center is. Does that answer the question?
I think it does. Thank you.
Perfect.
Awesome. Thank you so much, Natalie. This is Mackenzie from Fair Credit Foundation, and I'm going to give a little bit of information about us. As a nonprofit, we are located in Salt Lake City, although all of us are working remotely currently during the pandemic. But our mission is to teach individuals and families how to manage their finances and to improve and sustain their financial well-being. So a few of the services that we provide include financial coaching. We have a debt management program. We have a match savings program called IDA, which stands for Individual Development Account. We teach financial education in the community. Right now it's all actually online. And then we have a program that helps you to refinance high interest rate loans such as payday loans or title loans in conjunction with a local credit union. All of our services are listed on our website, faircredit.org, and they're all free of charge as well, at least especially the financial coaching is a huge asset that if you're interested in scheduling an appointment, please reach out to us and I'll give some more info here at the end. So I'm going to talk a little bit about taking care of your health on a budget. I would say that one of the biggest things when it comes to my clients is they'll say that sometimes the medical debt that they carry or the medical expenses are taking up more of their budget than they can handle. So I'm going to give you some tips and suggestions. The first one that I'm going to give you includes where do I go for medical care? So the first thing really to consider, and it's hard in the moment, but I have here listed the different options when it comes to when you're sick and where you should go. And next to them, I have a dollar sign, which represents potentially the cost in which it will be associated to get and seek help. So first and foremost, one of the least expensive options is always going to be going to your primary care physician, what Riley was talking about, a PCP. And if you don't have one of those, I highly recommend that you find someone, or for your kids, someone that when you have basic questions, that you can contact their office or that you can schedule an appointment. Right now, we're finding with the pandemic that virtual video visits are possible and they work really well. So those are two less expensive options when it comes to being sick and needing to seek assistance. And urgent care is going to cost a little bit more, and there might be some wait time associated with that, and you may not be able to meet with someone that you're familiar with, but it's immediate care that you can take or that you can go to. Then we have the emergency room, which is going to be a more expensive option of getting seeking help, and then of course an ambulance as well, which is very pricey. Now, in case of an emergency, I mean, I know all of us in those dispositions that might be the only option that we have, but keep in mind that if anything, when in doubt, you can always call your doctor and ask them what is going on and where you should be seeking help, depending upon what is you're experiencing or your dependent might be experiencing. Would you go to the next slide, please? All right, here's some tips to save on medical expenses. So the first thing is to ask your doctor about generic prescription options. Maybe you're already taking generic options when it comes to medications, but if not, and it might be expensive, you can definitely ask about the options that might be available to you. Another thing is some medications have a discount when you order more than 1 month at a time. So sometimes by doing this, there will be a discounted rate, and you can consider asking your doctor about this as well. Stay in your insurance network whenever possible for visits. So it's important to know what is in network for your insurance. And if you're not aware, you can always call the clinic, or you can call the location in which you're seeking service, and you can see what insurances that they accept. But if possible, whenever, try to stay within your network, as it will be more affordable for you. Then there are FSAs and HSAs. The difference between the two, the FSA stands for Flexible Savings Account, whereas an HSA is a health savings account. The difference between the two is that a flexible savings account, the funds must be used by calendar year. Sometimes they have a little bit of a carryover, but they must be used for health-related expenses, or sometimes it can be for medications and things like that. And that is by calendar year. So the funds that you deposit must be used within that year. Whereas a health savings account, the money that is deposited into that account can be used or cashed out for whatever medical needs without any time restraints. Both of these do have their tax advantages, as they are not, or they have their tax breaks. So it's important and nice to have these options as something to help you save for an either expected medical concern or maybe an unexpected emergency for medical. Seek out low cost or sliding scale clinics. So I think Natalie talked a little bit about this, especially if you find yourself without maybe some dental insurance or dental care. There are plenty of options out there. I know that when I looked at 211 while preparing for this presentation, that there were many doctors as well as dental offices that offer that option in regards to if you do not have insurance, that you can still seek dental or medical care on a sliding scale clinic or low cost. Another thing to keep in mind is to create a monthly payment. So I will never forget, I got my tonsils out soon after getting married, and this big fat bill came, and there was no way that I was going to be able to pay upfront the cost that was associated after everything came in, the bills came in. So I created online through the institution that I got the surgery done. I set up a monthly payment of $100, and it really helped me to split up my large expense, and I paid it back over a year and a half. And that doesn't mean that you'd even have to do as much as $100. You can set up that payment arrangement, something that is manageable for your finances. Okay, next slide, please. Here are a few other additional resources that I wanted to mention. There are multiple prescription discount cards, but one that I have found very useful is from FamilyWise, and I've given the link there here, and I can actually make sure that we put it in the chat box as well. The reason I really like this this particular prescription discount card, or with this website in particular, is that you can go in and you can type in the prescription that you have and what the dosage is, and it will give you the list of locations as well as the discount that you would get if you were to say go to Walmart pharmacy versus Walgreens versus Smith's. So sometimes it will help you to even navigate, okay, what is the best place to be getting my prescription based off of this discount card. I know that Riley also talked about this, but if you might be eligible for Medicare or Medicaid, take the opportunity to apply at jobs.utah.gov and see if that is something that you might be able to have to help take care of your medical expenses, and especially if you find yourself uninsured. Use the cost out-of-pocket estimators that your insurance or the hospitals and clinics may provide. So I know that I had a baby last September, and prior to having that baby, I went in and just said, okay, what does it cost to have a C-section versus a vaginal birth? And I was able to kind of get a ballpark estimate with my insurance involved, how much I was going to have to pay. As well as a few weeks ago, I had another client who knew that they were going to have a knee surgery. And they said, I just wish I knew like even a rough idea as to how much it was going to cost. And I recommended that they go to the hospital's website and to look and to see. And so it's a great resource to go and just to see, roughly get an estimate as to how much your expenses might be. Apply for financial assistance. This is another huge thing. Most medical locations have assistance that you might qualify for. These applications can be done online or by mail. I know both Intermountain as well as University of Utah Health have these financial applications that you can apply for. I've helped many clients apply for them. If you want assistance in doing so, definitely feel free to give us a call. If you're not sure if the place in which you have had service done does have that, you always are welcome to inquire. Another thing that I have learned as a financial coach is that even if your medical debts are in collections, you still might be able to qualify and have those collections taken care of underneath that financial assistance. So it is definitely worth it if you're finding yourself, or if you found yourself uninsured for a period of time and drowning in medical debt. Definitely look into the option of financial assistance before exploring other options when it comes to paying back those medical debts. One other quick thing I wanted to mention that I didn't mention here on this slide is that when it comes to medical debts, when you pay those medical debts, when they're in collections in full, meaning that you do not settle on them, you can actually have those removed from your credit report as though they never existed. So that's when you don't settle, but you pay for those in full. So keep that in mind as you may find yourself with some debt, especially medical debt, how to go about approaching those. For more medical resources, you can visit 211utah.org or call 211, and they will give more specific doctor's offices or dental offices, as well as just generalized information for medical resources. So let's go into the next slide here. I have Heather take over from here. Thanks, guys.
Thanks, Mackenzie. Also, thank you, Riley and Natalie. Right now, I just want to let you know about the many offerings that Fair Credit has. We are on Facebook, we're on Instagram, we're on Twitter, and we try to push out quite a bit of useful financial information regularly to help this, if you want to talk to one of our coaches, we help you connect with them. We also provide a lot of general information, public events, classes that are coming up, and all the wonderful happenings around personal finance, especially during a pandemic. So please feel free to reach out to us, connect with us on those social media platforms. Moving on to the next slide, we are going to start doing some questions, but I also wanted to let you know that in the chat bar at the bottom, so if you hover over it, there's a little box that says chat, you can open it up. In there, you'll see some of the resources that we've already mentioned that are links. So Ellen put one on the FSAs. We also have one from Riley, that's the University of Utah Cost Estimator, which looks like a wonderful resource that you can use. Also, if you're looking to seek care, you can definitely reach out to the U of U Health or the OUCH group and the community health centers to see if you can't get that care. At this time, are there any questions? Please feel free to put them in the chat box and we can look through them and point them in the right direction. I know that I've got one, and I think Riley might be able to answer this. This is related to what adaptations are being made in the new era of digital environments to increase service to the underserved or increase access to the low income.
Yeah, thank you for that. So we at University of Utah Health have what's called the Wellness Bus, and it's funded by the Larry H. and Gail Miller Family Foundation. And pre-COVID, it went out into communities to do diabetes screenings for uninsured, undocumented individuals who just, didn't have access to health systems. And so now we've retrofitted that bus to go out and do COVID testing. So we actually have that going out. It's about 4 to 5 days a week. And we do it in mostly West Side neighborhoods in Salt Lake City. We coordinate with Intermountain and the state of Utah and Salt Lake County Health Departments to decide where that bus goes to make sure that we're all effectively hitting these target communities that are disproportionately impacted by COVID-19.
Mackenzie just posted in the chat the COVID-19 hotline number for those of you who have general questions related to COVID. I know that there's a lot of questions surrounding who pays for tests and things along those lines. I would point you to that hotline as the best place to get that information at this point. One question was, what is CHIP again? And is that just for children or can adults be on it?
That's a great question. So this is Riley again. CHIP is the Children's Health Insurance Program, and it is just for children. Parents can be insured through their employer or through Medicaid. But depending on their income level, I believe it's up to 200% of the federal poverty level, children will be on CHIP. And then once children are above that threshold, then they would switch over to Medicaid.
Thanks, Riley. Any other questions at this time? Does Medicaid look at assets? Asks Michelle.
So for everything except long-term support services, so for elderly populations, dual populations who are Medicare and Medicaid eligible, I believe that's the only instance where Medicaid is going to look at your assets. If you're just applying for your children or for yourself to be enrolled in Medicaid and you're not dual eligible, so Medicare and Medicaid, then they would not look at your assets. So if you're a college student right now going to SLIC, you're under 65 applying for Medicaid, they're not going to look at your assets, except for your income.
Thank you. Any other questions at this time? Well, Ellen, as the Executive Director of Fair Credit, would you like to close us out?
Sure. Thanks so much, Heather. And thank you, Riley and Natalie. I know Natalie had to jump off, but has offered to answer any questions via email. So thank you both so much for joining us today, and Mackenzie. And I look forward to following up with anyone who would like to. Looks like we have another message here. You know, enroll in free financial coaching. We're here. We're happy to help any way we can. We've got, you know, phone calls for coaching, Zoom. We actually had a gentleman write us a letter recently, so we are flexible. Please reach out to us if you want some financial coaching, and it's been a pleasure. I hope that you all join us for next month. We're going to do another workshop on navigating your finances during COVID-19. So thanks everyone, and look forward to seeing you again.